Now to this story, open enrollment for Obamacare begins today. Problems with the law mean consumers could face significant rate hikes in some parts of the country. There will also be fewer health plans to choose from. Margaret Brennan is at the White House with how the administration hopes to fix the problems. Margaret, good morning.
Good morning. Well, starting today, the administration will make a major enrollment push, but that could be a tough sell in states like Tennessee, where premiums are up 50%. For songwriter Wendy Jans and her husband Eric, life was sailing along until health insurer Blue Cross Blue Shield pulled out of the Obamacare market in Nashville. Did you panic?
A little bit.
Eric is an insurance broker, and most of his 300 clients were covered by Blue Cross. Your clients, can they still afford health care?
A lot of them are really nervous right now. They're really nervous.
Eric was also paid by Blue Cross, income he has now lost, along with his own family's insurance. You're an insurance broker without insurance for your family.
As of January 1st, unless we jump onto something else, we're looking at maybe $750 a month this year to $1,100 next year.
$1,100 a month.
Right, for a family of 4.
Blue Cross Blue Shield left the Obamacare exchange in 3 major Tennessee markets, citing a loss of $500 million over 3 years. That leaves 73 of the state's 95 counties with only one insurer, and average premiums up more than 50%. Other major insurers, Aetna, United Health, and Humana, have also exited markets in other states. One key reason? Not enough young, healthy people signed up to offset the sicker population, leading to losses for insurers.
We believe there are things that can improve this.
Health and Human Services Secretary Sylvia Burwell argues that the problems are fixable. She points to Obamacare's successes. 20 million people have health insurance today who didn't before the law was passed. The uninsured rate is now the lowest ever. To improve the market and lure back insurers, the administration hopes to enroll nearly 14 million more people. They're aggressively targeting millennials. But do you expect those insurance providers that have pulled out to come back?
You know, I think a number of them will. I think a number of them will over time as they look and see what happens in the marketplace.
Any promises in the new year that any of them will rejoin the market?
You know, at this point, I don't think any of them have made those kinds of decisions.
Now, Burwell also told us she thinks most Americans can buy health care for $75 or less per month, especially if they qualify for a low-income tax subsidy. But right now, recruiters are aggressively targeting community colleges, recent immigrants, and freelance workers to get them to sign up. Gail?
Okay, thank you, Margaret.